Evaluation of bisphenol A in pregnant women from 10 Caribbean countries. This study, conducted by Dr. Martin Ford from St. George's University in Grenada and a team of experts from Canada, investigated the presence of bisphenol A, also known as BPA, in pregnant women across various Caribbean nations. The findings from this study have contributed valuable knowledge to public health and safety, especially concerning maternal and fetal health. How does bisphenol A affect health, particularly in pregnant women and their babies? BPA is a chemical commonly found in many plastic products, including water supply pipes, shatterproof windows, and coatings for food cans. BPA is known to act as an endocrine disruptor, which means it can interfere with the body's hormonal systems. This interference can lead to various adverse health effects, particularly concerning reproductive and neurodevelopmental outcomes. In pregnant women, BPA exposure has been associated with reproductive health issues. BPA may affect fertility and reproductive health, potentially leading to complications during pregnancy. Neurodevelopmental effects. Prenatal exposure to BPA has been linked to developmental issues in infants and children, including behavioural problems and cognitive impairments. Increased risk of adverse health conditions. Studies suggest that BPA exposure during pregnancy may increase the risk of conditions such as obesity, diabetes, and cardiovascular diseases in both mothers and their children later in life. What methods were used to evaluate bisphenol A exposure in the participants? The study assessed BPA exposure by collecting urine samples from about 50 pregnant women in each of the 10 Caribbean countries included in this study. 15 samples were then randomly selected from each country. The BPA concentration in these samples was measured and analysed, allowing for comparison with data from Canada and the US. What are the main findings of the study regarding bisphenol A levels in pregnant women? The key findings include BPA being detected in all urine samples from the pregnant women included in this study. BPA concentration levels varied by country, with St. Lucia having the lowest average concentration and St. Kitts and Nevis having the highest. All sampled islands had higher BPA concentration levels than those found in Canadian and US surveys. Key policy decisions for Caribbean policymakers. Implement laws to ban or reduce the importation and use of products containing BPA. Educate the public, especially pregnant women, about the sources of BPA and ways to minimize exposure. Establish regular biomonitoring studies to track BPA levels in the population and assess the effectiveness of regulations over time. Encourage the use of BPA-free products and promote research into safer alternatives for materials currently using BPA. These actions aim to protect the health of pregnant women and their babies from the potential harmful effects of BPA exposure.